So ladies and gentlemen, welcome to the Preventable 2025. We are very pleased that this year we were oversubscribed, more than 400 participants, and that we have to close our registration early. We are also supported by many sponsors as well as speakers from different universities and also hospitals. We have covered a broad range of topics regarding to the prediction, prevention and treatment of diabetes, including inpatient and outpatient management, as well as the benefits and also risk of different treatment. Most importantly, I'm very pleased that the DPP Forum has provided a platform where many of our young investigators and also researchers and practitioners can share the knowledge and showcase their ability, and this is really very important for us to continue to drive the development of the field. So I hope you will continue to support us, and that I look forward to seeing you next year again.
I'm going to talk about some general guidelines on exercise prescription for diabetes, including considerations on frequency, intensity, the types of exercise and duration. And recently there are some increasing concerns about different types of exercise, especially the high intensity interval training and different types of intensity such as high intensity versus low intensity and physical activity volume. So which one would be more desirable for diabetes patients? So I'm going to present some evidence on some recent studies and for comparison so that audience can make their own judgment to decide whether they should choose which type of activities would be more suitable for their patients.
Today I presented some of my research findings regarding the effects of sleep deprivation on eating behaviors. So two key messages from my research. So one is that we actually don't find a consistent effects of sleep deprivation on caloric consumptions. In the two studies we have conducted, we look at people who are sleep deprived in an experiment. So we induce sleep deprivations in these people, and we see that their caloric consumptions is about the same when they're sleep deprived compared to when they are sleeping enough. However, we did see a slight difference in terms of protein intake at breakfast. For those people who are sleep deprived, they tend to consume less protein at breakfast compared to when they are sleeping enough. And the other key findings that we had was that we're looking at the effects of sleep deprivation on habitual eating, referring to when people eat in response to cues, not in response to hunger or desire for pleasure. So we did see that sleep tend to have an effect on habitual eating. So when people are sleep deprived, it seems like they have a harder time express a behavior that's newly learned in response to cues. So we speculate that perhaps sleep deprivation could have an impact on people's ability to express a newly learned behavior and may make it harder for them to change an old habit.
I'm so excited today to join this important annual event, the DPP. It's a really good platform for specialists, family physicians, nurses, and also other allied health professionals to learn and share. So not only the important to control diabetes and prediabetes early to prevent macrovascular and severe mortality in them, but also because 50% of people with diabetes are not aware of having them, so early detection also plays an important role. I also shared how family physicians, through comprehensive, continuous, and whole-person care, plays a pivotal role in early management of type 2 diabetic patients, and why family physicians always emphasize on preventive care in disease and complications prevention and detection.
DPP Forum is an excellent platform to connect the professionals and experts. Here we share our vision to different people in order to improve the diabetes management. So the next trend of diabetes is definitely the precision medicine. Now we are in the world of AI and data. We can analyze different kinds of data like the clinical, lifestyle, genetic data to tailor the treatment to different patients. My talk today is more about achieving the glycemic control at an early stage, especially at the onset of type 2 diabetes, can provide the legacy effect, which can reduce the long-term complications like the cardiovascular and microvascular complications. And metformin and DPP4 inhibitors combo is very powerful to provide more safe and also more durable glycemic control among our Asian populations who usually have the beta cell dysfunction.
So I've been actually attending the DPP forum since its conception, and I find it's an excellent platform for sharing knowledge and also to foster collaboration between many different healthcare providers with the interest in diabetes care. And for my part of the talk, I was actually been asked to talk about inpatient management of hyperglycemia. And for my talk, it's divided into three parts. For the first part, I've been sharing some data of the importance of glycemic control in terms of improving outcomes in patients under hospitalization. And the second part, I've been actually talking more about medical management of hyperglycemia, particularly emergencies like DKA, as well as perioperative management. And lastly, I've also touched upon special conditions, such as, especially now that we have more information technology, I've actually touched upon the use of CGM and also hybrid closed-loop insulin pump when we encounter them as patients are admitted into hospital, how we should manage these patients. And then finally to talk about more difficult situations, patients who are requiring steroid therapy and also enteral feeding during hospitalization, which may lead to very significant ups and downs in their glucose levels.
In this year's DPP forum, my talk is on the risk associated with new glucose-lowering drugs. Over the past 2 decades, we've seen tremendous advancements in diabetes pharmacological therapies. In order to maximize the benefits, we also need to minimize risk. And here I talk specific side effects associated with DPP4 inhibitors, such as the risk of heart failure, bullous pemphigoid, and I talked about the risk associated with GLP-1 receptor agonists, focusing on muscle and bone loss, and also the risk associated with ophthalmic complications and suicidality. And lastly, I highlighted the risk of euglycemic DKA among SGLT2 inhibitor users. Future direction should, other than acknowledging this risk, we should also develop strategies to mitigate these risks so that more people can benefit from these new diabetes drugs.
Very happy to be here to join the DPP forum in 2025, and I'm going to talk about the oral glucose tolerance test, the interpretation of different glycemic measures, the fasting plasma glucose to our plasma glucose, and also the newly added 1-hour glucose by the International Diabetes Federation last year. So we know that type 2 diabetes is a very heterogeneous disease, and we're in the era of precision medicine. There has been increasing effort to elucidate the heterogeneity of prediabetes as well as type 2 diabetes. But from the diagnostic criteria, actually there are some embedded heterogeneity because we are using different glycemic measures to divide diabetes as well as prediabetes. And these different glycemic measures, they actually carry distinct pathophysiological significance. So through my talk, I hope I can bring some insights or inspiration to the audience to learn more about this heterogeneous disease. Diabetes Preventing the Preventable 2025 provides a platform for people from different specialties and disciplines to join together to combat the diabetes pandemic, which is increasing in size. So for my talk, it's because of the similarity to a diabetes pandemic that osteoporosis is also a growing burden in the whole world. So we have to work hard to prevent this pandemic from growing further. So in my talk, I'm going to talk about what is bone health in diabetes, who are the ones we have to be careful about, and how are we going to prevent the complications from this osteoporosis that is fracture in these people with type 2 diabetes.
DPP Forum is certainly a great opportunity to meet the community with a passion to prevent type 2 diabetes in Hong Kong. I'm very delighted to join the forum today and be able to share with the audience on the latest clinical practice guideline on the use of vitamin D in preventing type 2 diabetes.
My topic is the collaboration of physicians and pharmacists in how to improve the pharmaceutical care in elderly people. So I will talk about all the clinical services that we have been doing in our hospital with the work between the pharmacists and also physicians.
People with diabetes do have increased risk of various types of infections and the associated adverse health outcomes. Many of these infections are preventable by vaccinations. It is really our responsibility to remind our patients to be up to date to these vaccinations. I would like to thank everyone for joining us at the Diabetes Preventing the Preventable Forum 2025. This year we had a wonderful panel of people from different disciplines to cover various topics related to prevention and management of diabetes and obesity. I look forward to seeing you again in 2026.